Supporting Health Communications Campaign. Hi, my name is Elenita Arella. My topic is on dementia. According to the Center for Disease Control, dementia is not a specific disease, but rather a general term for impaired ability to remember, think, or make decisions that interferes with doing everyday activities. Alzheimer's disease is the most common type of dementia. Though dementia is mostly affects older adults, it is not part of normal aging. Data and statistics of those at least age 65 years of age, there is estimated nearly 7 million adults with dementia in 2014 and projected to be nearly 14 million by the year 2060. According to the World Health Organization, there are 44.7 million individuals with Alzheimer's dementia in the world. By 2050, the frequency is estimated to triple as a result of an increase in number of elderly people around the world. About 40% of the people with Alzheimer's disease are suffering with significant depression. In elderly adults who reside in nursing homes, the prevalence of dementia-related depression is about 20% to 50% who experience depressive symptoms. Significant risk factors for depression were observed in the elderly. There was a connection between the length of years in a facility and the isolation due to decrease in socialization. Hospitalization for medical disorders in the elderly adults can increase the risk of dementia and depression and can be a burden to society. According to the World Health Organization, this is the dementia fact sheets. Key facts. Currently, more than 55 million people have dementia worldwide, over 60% of whom live in low and middle income countries. Every year, there are nearly 10 million new cases of dementia. Dementia results from a variety of diseases and injuries that affect the brain. Alzheimer's disease is the most common form of dementia and may contribute to 60 to 70% of cases. Dementia is currently the 7th leading cause of death and one of the major cause of disability and dependency among older people globally. In 2019, dementia cost economies globally $1.3 trillion US. Approximately 50% of these costs are attributable to care provided by informal carers, who provide on an average of 5 hours of cares and supervision per day. Women are disproportionately affected by dementia, both directly and indirectly. Women experience higher disability, adjusted life years, and mortality due to dementia, but also provide 70% of the care hours for people living with dementia. Signs of depression. They may include feelings of hopelessness, feelings of guilt, worthlessness or helplessness, irritability, restlessness, loss of interest in activities or hobbies, fatigue and decreased energy, overeating or appetite loss, thoughts of suicide attempts, persistent aches or pains, headaches, cramps, or even digestive problems. My topic, dementia, relates to my clinical scholarly project using standardized music intervention in elderly dementia patients with depression is associated with a 10-point decrease in the Cornell scale for depression and dementia after 8 weeks of intervention. The project will include 30 elderly patients aged 65 to 85. It will be conducted in 8 weeks. Recruitment strategies involved in acquiring a list of dementia patients with depression who are 65 to 85 years in age in a skilled nursing facility, and the participation will be voluntary. They will have sign a voluntary informed consent. A little about my CSP. The sample will include demographic variables such as age and gender, the Cornell Depression Scale, pre-intervention and post-intervention. The Cornell Depression Scale will be administered pre-intervention and then again at 8 weeks. Paired t-test will be compared for the Cornell Depression Score for adults aged 65 to 85. My goal is that more people will be knowledgeable about depression and dementia in the elderly.